Hello, thank you for joining today's webinar on CQC's draft strategy with a focus on the smarter regulation theme. My name is Natalie Coleman. I'm a policy manager here at CQC and I'm part of the team working to develop our next strategy. So the Care Quality Commission is the independent regulator of health and adult social care in England. We make sure health and social services provide people with safe, effective, compassionate and high quality care, and we encourage care services to improve. We were established as an independent regulator with a clear purpose, and that purpose is more vital than ever. The world in which we regulate has changed significantly since we were created. The COVID pandemic has accelerated that change further. New and innovative types of service have started setting up using digital channels, and new restrictions have really changed how services can deliver care. So in this new world, we must also transform. We need to make changes to the way we regulate so that it's more relevant and has positive outcomes for everyone. And we need to be more flexible to manage risk and uncertainty. We've learned a lot from our response to the pandemic, and we're using this to put us in a better place for the future and to support services to keep people safe. We have a responsibility to change people's lives for the better, and we're carrying out that work in a changing environment. The approach of delivering care in a system is very different to the single provider service model that CQC was really set up to oversee back in 2009. And it's not enough for us to look at just how one service operates in isolation. We've also seen during the pandemic that renewed focus on inequalities in health and care. So we want our new strategy to help health and social care providers and systems to achieve this. So our strategy is built on 4 themes that run together to really set out those changes that we want to make. Running through each of those themes is our ambition to improve people's care by looking at how well health and care systems are working and how they're acting to reduce inequalities. Our aim is to implement our new strategy over the next 3 to 5 years, but to enable us to be as flexible as possible and to adapt to those changes in health and social care that we might not be able to predict. We'll continue to review it when we need. The first of these themes is people and communities. So we want to be an advocate for change. Our regulation, it should be driven by people's experiences and what they expect and need from health and social care. We want people to always feel listened to and understood, and to know that we've acted on what they're telling us. And we really want our information to help people make decisions about care and to enable and empower them to drive change. The next of the themes is safety through learning. So safety is a key concern for us as it's consistently the poorest area of performance that we see in our assessments. So we want to promote open cultures where the voice of health and care staff and people who use services drives learning and improvement. Thirdly, we have accelerating improvement. So the support available to help services improve and the quality of care really varies both between and within health and care sectors. So we will do more with what we know drives improvement across both individual services and systems of care. And then finally, and the 4th theme, which is the one we'll be focusing on for today's webinar, is smarter regulation. So what is smarter regulation and why is this theme so important to our next strategy? So we want our assessments to be much more flexible and dynamic. We want to update ratings much more often than we currently do so that we're really providing an up-to-date view of quality. We want to be smarter with data so that our visits can be much more targeted and with a really sharp focus on what we need to look at and what matters most to people. The ambitions that we set out under this theme could not be more timely. The pandemic has really forced health and social care to think differently, and we're no exception. Providers have made really rapid changes to the way they work in order to compete with the rise in demand for services. And this has accelerated the need for us here at CQC to change the way in which we regulate to improve outcomes for people. So there are 4 pillars to our thinking on the smarter regulation journey and what success will look like. The first is around this idea of being targeted and dynamic. So we now have a baseline understanding of quality across health and social care, and we know that the quality of care and people's experiences in a service really can vary from day to day. So we want to be able to provide a much more consistent and up-to-date and accurate picture of quality, making sure we're using the best available information to help keep people safe. This is going to require us to have a much more dynamic approach to regulation than we currently have. We're going to need to use all our regulatory methods, tools and techniques to assess quality, rather than just relying on scheduled, all-inclusive on-site inspection visits. Now, site visits are a vital part of our work, and they're essential in many settings to observe the care that people receive, but they're not the only way in which we can assess quality. So we want to move away from rigid inspection frequencies and shift our focus to making the right intervention at the right time. We can then concentrate on how we harness different ways of gathering views on quality. We want to use the eyes and ears of provider staff and people who are using services alongside targeted inspections, stakeholder information, national and local data sets, relationship management, provider self-assurance, accreditation, and so many more things to be able to continuously inform that view of quality and our ratings. The second area that I want to highlight is our commitment to ensuring it's easy for people to work with us. We all have a common drive to improve people's care. So from the point of registration, we want to be developing and building ongoing collaborative relationships with services which are built on openness and trust. We want this to really enable effective and proportionate regulation so that we can focus our regulatory work where quality needs to improve. We believe there are a number of key areas where changes could have a really significant impact on your experience of working with us. Firstly, we really want to do more around how we can improve our digital interfaces with you. And secondly, we want to gather information differently and reduce the duplication of requests by developing how we work with you and others in a data space. We want to work with providers and other regulators and partners to coordinate data collections. We want to reduce the duplication and workload for providers in collecting and submitting data to us and to other organisations. We only want to ask for you the information that we can't get anywhere else. The mantra that we're kind of exploring is this idea of collect once, use often. The third is making sure that here at CQC, our ways of working are future-proof and they're really focused on what matters most to people. So like the services we regulate, we're evolving to adapt to changing models of care, such as integrated systems and digitally enabled services. The move to looking at how services work together in a local system is a really significant change in our approach, but we think this is going to be a much smarter way for us to regulate. So we want to work with providers and partners to understand how care is changing and ensure that our model keeps pace with that. We also really want to strengthen our focus on key areas, such as how services meet their social and ethical responsibilities, including things like environmental sustainability. It's just so vital that our regulation focuses on what matters to people as they access, use and move between services. So we want to look much more closely at those aspects that we know have a positive effect on quality, such as culture in a service, how it works with other services in a local system and how it drives improvement. And then finally, we want our regulation to be relevant for all. So we want to make sure our ratings and information help people make informed choices about care and to give services an assessment of their performance to encourage them to improve. We want to move away from long reports written after inspection and instead provide information and data that's much more targeted to different audiences, making sure that people are able to get information from us in ways that suits them. We also want to provide a clearer definition of quality and the standards that people can expect, which can be used as a really powerful reference for what good and poor care looks like. This definition will be at the heart of our regulatory processes and will help us improve consistency in what we do so that people can be confident that good means good wherever they are in the country and whatever service they're using. So I mentioned earlier in the webinar those golden threads of our strategy around how well health and care systems are working together and how they're acting to reduce health inequalities. So we know that it's more important than ever for health and care services to work together as a system to deliver care and to meet the needs of local populations and of each individual. So it's no longer enough for us to just look at how one service operates in isolation. It's how services work together that has a real impact on people's outcomes. We also want everybody to have access to safer and better quality care, and we'll champion this in everything we do. We want to understand why there is such a variation across the country in how people get the care they need so that we can help tackle it. And we know that the COVID-19 pandemic has really highlighted the inequalities that remain across different areas of the country and different groups of people. So we want to use the learning from this to really enable and support change. So we want to hear from you both on our vision for smarter regulation, as well as the other themes across our strategy. The quickest and easiest way to respond is through our online form. The link is available here for you. More information can also be found there around how you can respond in different ways. A reminder that the consultation closes on the 4th of March, so please do get in touch. We really look forward to hearing from you. So that just leaves me to say thank you very much for joining me today. I particularly appreciate you making the time in such a busy moment for health and care, but we look forward to your responses, and on behalf of me and my colleagues across CQC, thanks very much. Goodbye.